What's up, you auto traction animals? In this episode of 3 PTs in a Pod, we discuss finals and we go over our strategies for studying. We go over a fan suggestion, and we finish the episode with a PT Mad Lib.
Ooh.
What's up, guys? Welcome back to 3 PTs in a Pod. We are back with you again. It's the go-to.
That's my thing, guys.
All right. So this week we thought we would get started with talking a little bit about finals and preparing for finals because we are about to take finals. We are running up on that time of the year, finals season. So we were going to talk about that, some suggestions for getting ready for finals, how we approach them, both written and practicals. So anything to get started with? I figured we could kind of just lay out what our schedule is going to be for finals week.
So what is our, so Monday?
So Monday we have neuro written to
get the worst out of it.
Neuro written, to kick us
things off.
Oh, man.
At 7:30 a.m. too.
Yeah, and I was telling you yesterday, that was like forever ago when we took the midterm.
It was,
like,
yeah. But
our
last week
midterms
of
were
February,
so.
right?
Yeah, it was. It was like late February.
I was thinking about our last neuro final from last semester and what a disaster that was. And I wanted to throw up.
Yeah.
Yeah, so it's been a while. We've gone through like 2 new modules since, basically. So that's going to be rough. And then Tuesday's no joke either. It's musculo and cardio written.
It is, yeah. So musculo written, cardiopulmonary written on Tuesday, 7 to 9 a.m. for musculo, and then 2 to 4 p.m. for cardio. So last little 3-hour high-intensity interval studying before the cardiopulmonary. Yeah, a little hiss.
That's a couple episodes of Dragon Ball Z.
So then Wednesday we have a little.
This is going to be interesting.
Yeah, so hybrid practical, both neuro and cardiopulmonary together as one practical. So that's our final practical for those 2 classes. Then we go into Thursday with our musculoskeletal practical from 8 to 12. And then we wrap up finals week with our modalities written final from 12:30 to 4:30. So strap
Couldn't
up.
have asked for a worse worse finals schedule.
Finals,
yeah. Honestly.
Yeah, it's pretty rough.
I would honestly double up another day just to have that Friday off.
Yeah, and to wait till 12:30 just for modality.
Mm-hmm. Yeah,
and we get bombarded neuro, then double practical, then a hybrid practical, and then a real musculoskeletal practical back to back to back to back.
Yeah, it's deck is stacked against us, but you know.
This is what it's all about, man.
Yeah, this is it.
If you're a pressure performer, this is what you thrive
This is what you live for right here.
Yeah.
So every semester is the same, basically. I look ahead and I'm like, oh, I should start studying for finals now.
Wait, you look ahead a month ahead?
I wouldn't know.
I should start studying now.
I should show you my planner because 2 weeks ago it said start studying neuro final. And then I'm like, I don't have to worry about that.
I'll forget all this shit anyways.
Yesterday was the first time I looked at it.
Insane, man.
Yeah, nice. Yeah, I'm today is the day I start. Definitely today. So so let's start with the written finals. So we've got written finals Monday, Tuesday, and Friday. How do we approach those? What's the strategy? Is the strategy different depending on the class? What do you guys do?
Yeah. So most of them are cumulative. So
Correct.
I save all my PowerPoints in folders. I'm not that organized, but I find that to be helpful. And then I just run through them in order. I sort of
go from the very beginning and then all the way through? Okay.
Mm-hmm. Yeah, so yesterday I started at 1, the first ever PowerPoint for neuro that we had this semester.
It was looking at it for the first time.
It honestly was. I was like, I don't remember this at all. And then, so I'll just run through that. I don't like to mixed days, so I'll designate one day to neuro, one to cardio, one to musculo.
I'm the same.
Because then, I mean, some courses do carry over. Like cardio and neuro I did fine this semester to sort of carry over, which is why we might be having the hybrid practical. But so yeah, I'll try to knock 2 to 3 PowerPoints out in a day. I usually try to count like how many I need to do before the time and like just divide it out into how many days I have before we actually take it. I don't mind like studying like PowerPoints actually.
Mm-hmm.
I take all my notes on my computer, so it's not like I'm disorganized. Like everything's right there.
Yeah.
I just check the notes. If I'm like stumbling on something, I'll remember that and like save it for the very end to go back to it. But usually I'm fine doing that. I like to go down to the lab to study. I just find it like to be better because that's where we do all our stuff anyway.
Yeah.
I tried studying in my apartment. I mean, sometimes like after dinner, I'll just look at some notes in my apartment. But if I know I'm going to be studying for like 2 to 3 hours at least, I'll go down to the lab, just in case I want to like try something, like practice something.
Yeah.
Mm-hmm.
And then just like look at any books or anything. But yeah, so like I said, I try to designate each day to a certain topic. Today is going to be cardio day. I'm trying to go in order too, so like obviously neuro was first, so
Yeah.
because I mean that finals week is going to be rough, but I know I'm going to be studying for like the tomorrow's final today, if that makes sense. Like on Monday, as soon as I take neuro,
Yeah.
I'll probably go down to the lab. Hopefully no one's there, and then just start studying for musculo and cardio for the next day. Yeah, I mean sometimes it's depending on the class. Like we've had quizzes for musculo throughout the semesters, which is good. Same with modalities. So I'm trying to. We did just have a quiz on cardio, and I feel like the midterm was last week too.
Yeah,
Basically
right.
was,
That's true. Yeah.
yeah, so I mean I'm kind of numb to it now. I feel like I don't really I'm not that stressed about finals week until
No.
it's like the night before, and then I'm like, shit, I don't
Yeah.
know if I know this shit at all. And then I mean, so far so good. I'm still here. So.
Yeah.
Yeah.
Yeah, I mean, I consider myself sort of a blue-collar studier. I kind of just, like, bang out repetitions. Like, I'm just kind of try to run through a brick wall. So I'm kind of similar. Like, I go through the PowerPoints, and that's basically, like, the bulk of my studying is just, like, I sort of have at this point, like, an intuitive, like, sense of how many times I need to go through each PowerPoint to know the material well enough to get either like a high B or an A. And then like as I'm going through it's usually like 3 to 4 times with each PowerPoint. And like the first time I'll take it slow and like actually kind of try to take in as much as I can from each slide. And each time it's
Didn't take that long.
Sort of like progressively quicker and like looking at less things. I'll sort of like key in on certain things on particular slides. And also our written tests are mainly multiple choice. Yeah. So you can sort of see a slide and see where a multiple choice question would come from, or like remember what was sort of highlighted in class. You
kind of like make your own questions in your head. You're like, I could totally see them asking this. Yeah, that definitely helps.
Yeah, it does.
And sometimes too, I'll go through like maybe the first or second time through the PowerPoints and I'll like actually highlight the slides. So I pick out like maybe 4 or 5 like words or terms, like part of a sentence that I look at as like important and I want to memorize that. And then like I might even by the last time just delete the other words and just be like these like things I need to remember. Or like lists in my head, like a huge mnemonic guy as well.
Yeah, big fan.
The dirtier, the better. So I'll do that a lot too if it's like lists. Like these 4 things are like the main signs of like whatever cardio issue. And it's like the first letter of each of those, I make some sort of mnemonic. Because a multiple choice test, you can generally, I think, get it down to like 2 maybe. And then between that, I sort of have like a like memory where I just see it, like a picture, memory in my head, like see the slide in my head.
Yeah. That's the best too when you're like, fuck, I can pick slide 26, PowerPoint 3,
exactly.
the 3rd word.
And you remember like
every other word except that one.
That happened to me on cardio.
Exactly.
Every like muscular quiz is like that too.
But yeah, that kind of forms like the bulk of my studying is the PowerPoints. I don't read textbooks, refuse. So
I don't even buy them.
so what's up? Don't read the textbooks, so don't bother with that. But I will go back. I normally handwrite notes in class, so I'll like, as we're going through the PowerPoint, I'll write like on my notes like slide whatever number, and if there's like an additional point made, I'll like write it down or something that sounds like important that's said in class that's not on the slides. So I'll usually go through those as well, like a couple of times, like my handwritten notes. And those are more like functional because I can take them like anywhere. Like I'll
Right.
sometimes be
Yeah.
like walking on the treadmill and be like looking at just reading through my notes. So I like to do that. And then like the last piece of my studying is usually if we go over certain like outcome measures in class or handouts or something that I look at as important, like that'll be the last thing. I'll go through those maybe a couple times.
Yeah.
So
Yeah, I think mine's pretty similar to your guys' approach because, yeah, I'll just, I'll kind of think about what I need most because, like, there's some subjects that you just don't need to study as much, like things like modalities or like if you, like the quizzes in Musculo, you're studying, every other week for a quiz. You already kind of got those repetitions in, so you don't need to focus on them as much.
Mm-hmm.
Whereas like something like subjects that I would like struggle in, that's where I would start. And as it so happens, like neuro is our first exam, and it happens to be the subject that like I would struggle on the most.
Yeah.
So that's where I started. Like yesterday, that's where I started. And I took a different approach than you. I don't start from the very beginning. I start from like after the midterm because that's generally going to be the focus
Right.
of the exam. So I'll make sure I have all that nailed down, and then I'll go back and review stuff. And like I won't go as hard just because hopefully I did retain some of
Right.
that stuff that I
Yeah.
studied for the midterm. So I'll just review that stuff, and then again go back to the new stuff, make sure I have that down, and then like you said at the end, I'll go through like the lab sheets, the
Mhm.
outcome measures, whatever I need to know, and that's pretty much it. I don't have too much of an intricate system. It's all about kind of repetition and reviewing that stuff. I do the same thing as you, where I look at one subject per day, but I think it's actually more beneficial to switch.
Yeah.
From what I think I just read this, where like you're supposed to, review something and then go to another subject and review that. It helps you retain information.
Yeah.
Because I know, like, for neuro, I'll read through one slideshow, I'll start reading through another one, and I'm like, fuck, I don't know. I'm sick of this. I don't want to do this anymore.
Yeah.
And then on that point also, like when fatigue sets in, like when I start to realize that I'm not retaining anything and I'm just like reading and I'm like, what the fuck did I just read? I have to go back.
Yeah.
I'll stop.
Yeah.
Like I'll stop because there's no point. I'm just wasting my time.
Yeah.
Like I'll go to the gym, I'll go make food, like I'll go watch Dragon Ball Z or something, just take a break, and then when I feel like I can, focus again, like I'll go back to that. And sometimes, you can't, like you just like can't get into it.
Right.
And I don't really beat myself up over it. I just, wake
Yeah.
up the next day and try to hammer that.
Yeah, and sometimes like I'm sort of the same way in that like I have those numbers in my head of like how many times I need to get through each like PowerPoint for the classes, but sometimes it's not the most like dialed in. Like it's
Yeah.
just about that number. Like if I
Yeah.
just grind through it, even if I don't feel like I'm really retaining it as well as maybe the first time or the time I did it like a day ago, it still is beneficial to go through it.
Well, that's like one
Um,
thing. Like if you're going through it the first time,
Okay.
and you like really focus and you get it, the next times you go through it, like
Yeah.
you don't need to be as focused because you're skipping over slides because you already know a lot of
Right.
stuff. So.
Exactly. And that's why I do it multiple times, because I find each successive time I sort of like pick up on a little point that I didn't the first
Yeah.
time, which maybe if I prepared better throughout the semester I wouldn't need to do that as much. But
Yeah.
I find like each time through I pick up on a little detail that's like maybe important for like a particular question. And then I think too, I don't know if this would apply to like necessarily every school, if maybe some programs if they have like more overall professors, but we've had a lot of our professors now since like last year, and you sort of get to know their personal like leanings in terms of like what they look at as important when they're
Yeah.
making questions. Like Musculo is very like kinematic focused and
Right.
biomechanics and like anatomy of how things are working and like
Yeah.
situationally, like if someone has a problem with like, you know, this movement, like how would you treat it, or they
Yeah.
present with this in the clinic, sort of like a case-based scenario. Same with cardio palm,
Yeah.
always
Yeah.
like a lot of case-based stuff. So in that sense, I know when I'm going through the notes, like don't just fucking like blindly memorize these terms. Like that's not what they're gonna ask. Like understand how it would be done in treatment or
Yeah, like I know for like when I was studying for the musculoskeletal quiz, like the kinematics part, like for sure, like you like have to focus on it a lot. And like I'll sit on a slide, and if I'll make sure like I'll close my eyes, and like literally picture what the motion that's happening
Mhm.
or whatever, and like I'll make sure like I can picture it and understand what's going on before like I move
Yeah.
on.
Yeah.
And I think that's important. Like, yeah, you could use like visual stuff. Like you could watch videos, and like I have an app called Complete Anatomy, and that gives you like a visual representation.
Nice.
And then I think that
That
because
is
like
awesome.
for us, for
that
sure,
app is so cool.
yeah,
I've never heard of it.
yeah, it
Right.
was on sale for like $10. So
Cool.
I think
Visual
musculo
anatomy.
is like that too, because you don't need to like memorize anything, like you just said. If you understand the anatomy, then you
Right.
could like do it. Like, all right, if I tilt my head and then
Yeah,
lean
yeah,
back,
yeah.
all right, that's like backward nodding. That's like
yeah,
right
like
away.
mobilizations, like you know,
Yeah.
if you know the kinematics, you know what mobilization.
Where other courses, it's like you need to memorize that slide, like picture the slide.
Yeah.
So
Exactly.
that's
Yeah.
why I might stay. Do you think there's a placebo effect for studying? You kind of just like hit on it before. You're like, if I go over something 3 to 4 times, even though I didn't like do my best at it, I feel like I know it better.
Yeah, it's
Do
possible.
we just write a
Yeah.
study?
I don't
A
know,
study
maybe
about
Study
studying?
search.
maybe I don't know if this actually has an effect on like your grade, but like if you're studying and you like have the mindset that like I already know this shit, like even if you don't, like you're just skipping through slides, like I already know all this stuff. You go into
All
the
right,
exam.
you do that. Let me know how it
You
goes.
go into the exam more confident, and you end up like doing better because you're not like so unsure of yourself, where you're
Yeah.
changing answers and things like that, and you like stick to it,
Yeah.
and then you might end up doing better. So maybe there's a placebo
Yeah.
effect.
And one last thing, I feel like there's a direct correlation between like time until exam and like how focused I am studying
Oh,
for that.
yeah.
Like
Mhm.
2 weeks, I'm like, 2 weeks, I can do so much in 2 weeks. But like day before, I am grinding
Yeah.
like
Yeah.
probably like 4 to 5 PowerPoints that night,
Yeah.
and like good PowerPoints, not like, oh yeah, I skimmed through that one.
Half-ass it. Yeah.
But I
Absolutely.
work better under pressure. That's with
Oh,
anything
dude,
though. I
yeah.
won't do a
Oh,
paper till like the night
Same.
before.
That's
I try
so
my
true.
best to like, all right, I know I'm gonna have a shitty April. I better do this paper now. And I'm like, nope.
Yep.
I'm gonna enjoy the fuck out of March. That's what I'm gonna
The
do.
funny thing is, I always beat myself up over being like a super
Dude,
procrastinator.
Yeah.
But then I'm like,
24
you know
years
what?
of this
It hasn't
shit,
failed.
dude.
It hasn't failed me yet.
No,
so you,
still
you know,
here,
I have
dude.
like no incentive to stop.
Survive in advance.
Survive in advance, dude. That's what it's all about. Especially at this point, spring semester, second year,
Oh,
dude.
yeah, man. Just
That
trying to,
senioritis,
just, literally
boy?
Just trying to get through, man.
Not even in our third year yet.
Just trying
That
to get my degree.
senioritis, boy.
Shit weather to go with it though.
Yeah, well, that's true. At least it hasn't really been that nice
Yeah.
um,
Fucking
recently.
April. It's mid-April.
Mid-April,
Past
and it
mid-April.
was fucking snowing yesterday. Nuts. But so what about practicals? How do we tackle that? We'll have, I guess, just 2 practicals this time, since the one is a combo practical, little combo platter. But how do we, like, how's that different?
Well, I
than,
think like the studying for the written kind of builds your foundation.
absolutely,
So I mean, you have to know just like the theory behind
absolutely.
the practical.
Right.
So once you know that, I think like for me it helps just like working through it in my head.
Yep.
Kind of like a thought experiment. So like I'm literally talking to a patient in my head. I'm thinking of like what I would do, how I would do it, and like imagery, like in sports, like imagery works to build technique. So why wouldn't it
Mhm.
work to build like your hands-on techniques and your like measuring techniques or whatever? So I do that a lot, and then sometimes like especially for like big exams, I'll go to the lab, and these guys will be there, and write stuff out on the whiteboard. Like I remember
Mhm.
last year for the final, we had the shoulder practical, and we
Yeah.
wrote out every special test, like for what condition
Mhm.
you would do
And
it.
like an intervention for
And
it, too.
intervention, and like that helped a lot because like that was like in my head. I sat there because I had to like think about it, like we didn't go to our notes to like try to to just copy. We
Yeah.
like try to remember what we had to do,
Work it out.
and that kind of helps. You just work it out in your head, and then you write it out, and then I don't know if you.
I think that correlates much better to practical situations because that's what you have to do during a
Right.
practical. You're in a, mock one-on-one scenario with a patient, but also a, grader. So if you've gone through a conversation before with your classmates, it has much more of a carryover effect, I believe, than doing that like group studying thing for written tests. I never like to do that for written tests. Like,
Right.
I want to be in my own head and know what I fucking know.
Yeah.
Don't like clog my mind with bullshit that might be
Yeah.
wrong.
Sometimes,
Um,
although like I will say, even if it's like, if it's not my question, if I hear someone else's question and like people start talking about it and I listen and I'm like, okay, like that kind of actually cleared it up.
Yeah.
Even though like
Sometimes,
I didn't even
yeah.
know I had that question, like their conversation
Yeah.
cleared it up for me. So
Mhm.
sometimes it helps, but I do agree. Like for me, like for written, I usually just study alone and just get through it.
Yeah. Yeah, it's a give and take. I mean, for every 2 to 3 questions you might get out of that, there might be like 2 or 3 more you get more confused
And
on.
that
So it's
might be,
just a
like,
personal
An hour
preference.
of wasted time bullshitting.
Right.
There's other people around.
Definitely.
Mhm.
But yeah, for sure on practicals, it plays a big role, I think, to be able to talk it out and just talk through it with classmates and write it on the board. The recall is a lot easier. Put it on the board. But yeah, so what about you, KP? Anything different?
Yeah, I think
for
it's
practicals.
I think it's funny how like far we've come since practicals. I remember
That's true.
like we've built on them obviously. Like we started out worrying about like, oh, I gotta hit all these subjective shit. Like I gotta worry about all these
Yeah.
review systems
Yeah.
review, and now that's like back burner shit. Like I
Yeah.
just fly through that. Like, all right, yeah, you don't have anything going on. Like I even like remember like, all right, any cardiovascular, any
Just second
urinary
nature.
problems, yeah, and then just run through that, and then you sort of, and now that was like first thing, and then you're like, all right, range of motion, I know what to do, know what position. Now it's like special tests and interventions that you are really worried about because everything's new now.
Yeah.
So the way our class is broken up for musculo is like we go through body part by body part. So now our practical is on neck and thoracic, cervical and thoracic spine. So these are tests that we've never even done before, never even learned before. So now it's just like a practical skill set essentially. So I go into the lab, practice those. I mean, we've been working through them in class too, like the MOBs and everything.
Yeah.
And then it's just a matter of like being able to differentiate what you should do in that situation. And I think that's the best because that's what we'll be doing for the rest
I
for the
love
rest of our life.
practicals.
We have like one big test, written test in our life really. The practical is what we do like
Yeah.
our
that's
entire
true.
lives. So
Yeah.
I'm not really worried about written, and I'm not really worried about practical anymore because it's like almost enjoyable to me because like you pass by like succeeding, and succeeding is fucking awesome. We've
Yeah.
talked about that before, like the Grinch smile, like getting
Yeah.
that, and that's the best feeling. When you are able to diagnose that patient and like treat them, and they're like, all right, good job, and you do a good job on your practical, that's
Yeah.
the fun.
Yeah.
I'll take an A on practical over an A on written.
When you
any
nail
fucking day.
like that diagnosis
Mhm.
or like the treatments and like you
Mhm.
know you did it, you're like walking out, you're like, fuck yeah, that was awesome.
Just drop your gun.
It's like exciting, yeah. It's
Go
like
and
it's
drop.
exciting.
Goni drop. Sheesh. Yeah. Yeah, no, for sure. I mean, I think I'm pretty similar to both of you guys. I think, like, systematic approach, I like to break it down sort of, especially with neuro and cardio palm, I think, which are,
Yeah, wasn't thinking that.
yeah.
I don't even know what to expect from that practice.
Yeah,
honestly,
that's
so.
gonna be a doozy. But like starting with, so I like you, Artem. I like to start sort of in my head, just mentally, like going over different case scenarios
Yeah.
I might see. Like you said, KP, they do a pretty good job in class of like running through those with us ahead of time, giving us a lot of different cases. So I'll start to think about that, like what have we talked about in class? What are the possible cases I might see? Second step is actually just doing some of the hands-on skills like by themselves. So if it's, let's say, AA MOB for musculo, I'll do that alone and just
Mhm.
make sure I have the mechanics right, like the feel for it, maybe even be able to like say something about what I'm doing and what I'm
Yeah.
looking for, what I feel when it's like right, when it might be pathological what I might feel. Because that's part of the practical as well. You have to be in the moment, able to sort of explain yourself. So that would be the second step, and then building on top of that, maybe play it out as more of a full case, like going through it like as if it was a patient and you're going through the process of putting all the pieces together, subjective, objective measures, and then testing range of motion, manual muscle tests, special tests, all as one. I think that kind of, and then at that point I'm pretty much ready to go, and then I might, very last thing, just again go over some cases and maybe some things that I've struggled with throughout the process, like 1 or 2 different skills that seem to be messing me up. Just go over those a couple more times, run through the cases in my head. Because you pretty much know, I mean, there's like 5 or 6 main cases that you're probably going to run across.
And that's when I actually, one of the few times I open up the book, because there are practice cases in there, and I'm like, all right, that's what a typical presentation would be. And then you can kind of, like you said, imagine yourself in that scenario, like, all right, I'll run them through this in this position, then have them lay down, and then do everything in supine, flip them over for some PA moves, and then sit them back up, discuss what I want to do, and then and then just picturing yourself in that situation helps so much.
And I think a good way to know that you're ready, like you should be hammering through that shit like when you're practicing it as a case. Like if you're fumbling on your wording or like explanations on something or performing a certain skill, you don't fucking know it well enough because you're going to show up to the practical, nerves are going to start to kick in a little bit. If you're unsure of anything, it's going to show up as you not knowing it when you're in the actual real time in a practical, if you can't just do it with your classmates.
And fake it till you make it.
Fake it till you fucking make it. Be confident.
Talk out of your ass if you need to. Just say what you know, and then
exactly
they'll buy into it.
Yep. Cool. I think that pretty much covers it.
All right, I gotta go study.
I've been reading my notes this whole time. What did you guys say?
Yeah. So anyway, we got a user comment or a listener comment on the YouTube.
Well, we had a lot, but this was
tons.
This was our top one.
The questions keep flowing in.
We should have an alarm like sound when we read.
We might need to do
track, like a ticker across like millions of emails, questions coming in. Tweets. But we want to make a point that when you as a listener reach out to us and hit us with a question that is just like, you're just have a burning desire to get the answer to, we're going to put that on the top of our priority list and get back to you because we care about our listeners so much and want to provide value to the listeners. So let's at least read what the question was and kind of explain what we're going to do to handle that question.
Yeah, so this was kind of like a suggestion/question. Do we say his name?
Should we HIPAA?
Yeah, let's keep it confidential.
I think that goes for YouTube too.
So a certain fan of ours commented on our second episode and said, would it be possible to add a segment that identifies one run-of-the-mill exercise a week, such as clamshells, and offer an alternative exercise that may be more effective and functional? It could be an extremely short segment talking about intended goals of the stereotypical activity and why the new one is an improvement. It's a great suggestion.
Great suggestion.
I got
In
really
all
excited
honesty, though, I think it actually is a really good idea.
I got really excited about it because, if you've been in a shitty clinic, you know exactly what he's talking about when he says run-of-the-mill exercise. Just like one of those things that every patient gets with no critical thinking, with no clinical decision-making behind it. Mm-hmm. And if you were to ask them, they probably couldn't tell you,
Yeah.
So, thank you, listener. We appreciate it.
Listener X.
Please send more. And if you guys want to send us your questions and suggestions, please either comment on our YouTube or email us at 3ptsinapod@gmail.com.
Yep. And because we liked that one so much, I believe we're going to make that into an actual segment. Where we take... I'm thinking like exercise court. So you have like an exercise, right?
That's a good
and
one.
there's like
we stand trial.
Yeah.
Should we get you like a little gown and
make a decision on it?
Yeah, one of us is the defendant.
But and not necessarily every time that like one person's completely against the exercise and one isn't, but just like present the exercise. Why is it usually used? What's the reasoning behind it, and does that hold up when you kind of break down that exercise and the intended purpose? Does it really hold up? And is it the most effective, or are there better options out there? I think clamshells is a great one to start with.
That's a great one to start
So that'll probably be the plan for when we
Yeah.
do install that segment, probably one of the next couple episodes.
Provide some research articles supporting
absolutely.
or against it.
Yeah.
Yeah.
Any initial thoughts, just to give a
Yeah.
little sneak peek into our thoughts about clamshells?
You guys want to handle it, and
Dude,
then
they're awesome.
I'll
Look
jump
at that.
in.
I mean,
What are your thoughts on the exercise?
so I think it has its place. I think any exercise, for the
I was
most
just
part,
gonna
has
say
its
that.
place.
Yeah.
But it's the details surrounding why and the exercise in general. Couple thoughts, not necessarily even pinpointing clamshells, but I think in particular with clamshells, one of the things I see that I don't always agree with is the amount of time they're done. So they get initiated in maybe week 2, 3 of a person's program, and they're there 3 months later still fucking doing clamshells.
Yeah.
Yeah.
Still with maybe like one band level up in terms of resistance. So I think that's a big piece of the puzzle there. Understanding proper progressions and loading for exercises. And that's, I don't always agree with in terms of how clamshells are performed. I think another thing is
That's our
how
next
many.
sponsor.
It's great
Turn
product
that-
placement.
turn that baby.
Thanks, Monster.
Dude, between the three of us, how many monsters have we had today?
Maybe
I've had 2.
This is my first one.
Okay,
I had a
zero,
coffee this
so-
morning.
Well, you're more of a coffee guy.
I am.
KP.
Yeah. I'm trying to wean off of it too, but maybe I'll just transition to Monster. Fuck
Yeah.
it, right?
Why? Yeah, why not?
I
don't know
did
why I
take
never
some
got into
pre-workout,
coffee.
that's why
Did
I
you?
am shaking a
little-
little bit. Yeah. Whew.
Little C4 there.
No one moved too quick. Damn it.
Oh, dude, the white monsters. If you haven't had
gotcha.
the pleasure of a white monster,
The
it's,
best.
it is the
It'll
best.
make your day.
Absolutely.
But yeah, clamshells.
Those were actually great points, Chris.
Yeah, I mean, like you said, I think there is a place for them. They're actually like sort of difficult, I feel like, for patients to understand and comprehend, and I feel like that's because they're super non-functional. Like how often are you like side-lying in bed basically to strengthen your hip? I mean, it's a good progression if someone isn't able to like tolerate standing for very long or just like any other glute med exercise. But I think like after they're able to do, I don't know, like you just name any number and how much resistance you want, but I would get them up and moving to a more functional stance and just transition them to gait if that's what we're working on. I mean, it depends obviously what the patient is presenting with, but I would like to make interventions more functional than just sideline. So.
Agreed. Well, and I think too, I mean, that's why I like this idea so much, because this clamshells could be an easy 15, 20-minute segment, which I'd like to kind of do that with certain exercises. But another piece of the puzzle is like how closely are you paying attention to their execution of the movement, and how well do you understand the movement yourself?
Yeah.
Clamshells is not that complex of a movement, but certain things like a squat or some sort of a deadlift progression, hip hinge, you definitely have to have an understanding of. But with clamshells even, how much hip flexion do you have? If you're allowing them to go into a certain amount of degrees of hip flexion, that's throwing off possibly how much of the glute med is working and how much other muscles are taking over. So I think those things are important, and that's also something you see in the research on clamshells in particular, and like glute med activities, like how much volitional contraction are you actually getting out of those muscles that you think are the main movers, and then when do you, like KP said, turn it into a more functional type of exercise that you might be working the glute med less and other muscles more, but that you need that combination of muscles in something like walking or performing your daily activities.
Yeah, so on that point, it's really like this exercise I feel like is really context specific, and if you don't think about what you're trying to achieve, then you might be misplacing it. So like if you have like a very deconditioned low level patient, you're just doing general hip strengthening, sure, like a clamshell with a TheraBand might work. But if you're trying to improve hip kinematics or knee kinematics, I'd probably say that's a pretty bad choice. And if you're trying to improve fitness, probably a bad choice. If you're trying to, do some advanced strength training, it's probably a bad choice. Just because, like you said, you can't load it. I've personally never seen anybody get really, really strong with TheraBands.
Mm-hmm.
You generally just don't see that, no matter if they're using a fucking black TheraBand. They're probably not going to get that strong.
What do you got against yellow TheraBand?
I think black's like the highest level. And then I actually did a research study on, or not a research study, I did a research review for a stat class last year on a study called The Associations Between Hip Strength and Hip Kinematics During a Single Leg Hop in Recreational Athletes Post-ACL Reconstruction Compared to Healthy
Arnold
Controls.
loves that. I'm pretty sure he's...
So this study actually
Okay.
looked at two groups, the control group that didn't have a previous ACL reconstruction and one that did. And they found that the hip extensors were actually the ones that were at fault for increased valgus at the knee. So the glute max primarily is what controls valgus at the knee, not the hip abductors. The hip abductors are actually more active at the pelvis. So if you listen to Pat Davidson talk about this, and Pat Davidson is one of my favorite human beings.
You forgot to mention
I
him
forgot
last-
to mention him last week. But
sorry,
he's
Pat.
he's a PhD in exercise physiology, and that guy probably knows more biomechanics and kinematics than anyone I've ever listened to. And he talks about this specifically, like, especially with the glute med. If you want true glute med activity, it needs to be at the pelvis. So like when he's looking at glute med activity, he's looking at a belt line of the pelvis. And if you don't have an uneven belt line, then you're not working the glute med.
Mm.
So that's where things like the most basic one would be like a hip hike.
Mm-hmm.
So that's a closed chain activity, a functional activity where you're training that muscle at the pelvis where it's supposed to be working.
And it's functional.
And it's
Mhm.
functional. But then you could obviously take that, step further. Any single leg exercises,
Yep.
any split stance exercises, split squats, rear foot elevated split squats, lunges, things like that, single leg deadlifts, like those are going to be way more functional and get you way more out of building proper kinematics, biomechanics, and strength than
What was the
pushing-
outcome they used on this? Do you remember?
They looked at like the
Just
actual
about.
kinematics of the so like this was what they were measuring, like the angle of the knee.
Did they do triple hop?
Yeah, I think so.
Yeah.
Or
I
single,
think I
just
know.
a single leg hop.
Okay.
So yeah, and then you could obviously alter, stances and planes, but like if you're trying to get frontal plane glute med
On the
activity,
frontal plane?
you're trying to get frontal plane of the pelvis.
Mhm.
Pushing your knee out and abducting your hip might not be doing the right thing that you're trying to get.
Yeah. Well, and that's why, because I think there's a ton of great research on this area, and that's why I think we should tackle it. I mean, we've already given a pretty nice comprehensive
We can just
discussion
wrap it up
on
next
Yeah.
week.
on this, but I would like to visit it again at least once more, starting with clamshells. But again, when it starts to be outside of your initial 2 to 4 weeks maybe of when they are very, like you said,
You
deconditioned
gotta
or
progress
low
people.
level.
You gotta get them standing.
Right.
You can't just keep them on the table.
And once you
They're
are
tired,
progressing
yeah.
towards functional activities that they're going to be challenged with and throughout their daily living and the movements they're performing on a daily basis, it becomes more about the group of muscles that is producing that movement versus one. Like
Yeah.
strengthening the glute med for a squat or a single leg deadlift, how much of an effect does that have if all the other muscles are weak and
Yeah.
deconditioned and not performing properly?
So going back to
Um,
our third episode where we talked about that we're trying to make people adaptable
Mm-hmm.
to their environment, I don't know if a clamshell is going to make you the most adaptable.
Right.
They're gonna be
being.
hella good.
Yeah, like
You know
it's
what I
gonna
mean?
be if you're in an
Getting out
environment
of
where
bed.
when you're laying on your
Getting
side
out
and
of
just
bed.
when you're kicking your knee out on your side, like you're gonna be hella
Oh,
adaptable.
dude,
to
you're
that
gonna be
environment.
strong as fuck doing
But
that.
once you
do
stand,
that every day.
everything changes when the foot hits the ground.
Whoa!
Should we
Settle
cut it
down,
there? Should we
dude.
cut it there?
Settle down.
Sorry, we just lost power for a
Somebody
second.
tweet that, please.
Oh man, but so again, another topic for another time. But I think that's where systems like PRI come into play that look at articular chains of muscle and how they perform in unison and how to assess for different points along that chain and where the dysfunction is, and using that as your system to improve overall movement.
Yeah.
And
Nothing works in isolation.
pinpoint where along that movement you're having issues. So
I saw a meme yesterday on physio memes or something like that. It was a guy. It was a picture of a guy like this, and his caption was, "Now I must forget everything I learned," or something in PT school, because this is learning to graduate, to take the test, and then once you meet your patients, it's like, all right, I gotta think outside the box. I can't just do clamshells for 8 weeks.
Exactly. Yeah, and that's where all this stuff comes into play, dude. You have to keep improving the level of understanding you have about how things work. You just said. I mean, you get the basic level to be dude, lick that off, dude. You just lost like 2 milligrams of caffeine right there. I need that. I need those milligrams. The fuck was I gonna say? I don't know. It's gonna be smart, but
We'll save it.
yeah, we'll save that.
Running on low
We can't
calories.
just give them all everything in one
Exactly. Yeah, too much value.
Cool. I think next week we should tackle TA drawings. I'm just
Just chomping at
yeah,
the
I'm
bit to
chomping at
get
the
there.
bits to get after that.
Oh, so that's what I was gonna say. You have to functional anatomy is like a whole different ballpark from what you get
From
in PT
dead
school.
guy anatomy.
Exactly.
You look at a cadaver, you might not really understand how the body actually works.
And that's what you just don't get. I was actually thinking, because we were just talking about our third year elective courses, and one of them is a sports physical therapy elective, and I would love for the first 4 weeks of that class to just be functional anatomy and teach how does the body and what is the process of performing this exercise, what is the biomechanical, anatomical execution of that movement. What does that look like? Because I don't think we really get that.
And
you get
why?
it right,
Why is it executed
Right.
this way?
and slightly in kines, I think we get that. A little
and like
bit.
you said, when everything changes when the foot hits the floor. That
Yeah,
was
I did say
Oh,
Is that copyrighted?
Yeah, by me. Yeah.
Oh,
Okay.
alright. So my bad. How much do I?
I'm actually making a
5.
course. I'm making a course titled that. So you
That's
can
the
come
title.
actually.
Yeah,
It's
but that was
$500.
that was the first time we learned functional anatomy. All right, it was that way in this situation, but it changes in this situation when it's actually functional.
Right,
So,
exactly,
yeah, I can't
dude. It's
wait for-
the hip comes into flexion, and all of a sudden, the piriformis is acting in a different way. And we're like, what the fuck?
Wait,
Hold on a
no, it
second.
doesn't. It's an
No,
external
it's-
rotator. Fuck you.
Adductors, become extensors.
And that's when half our class loses their shit.
Exactly, and well,
it's never
whatever.
black and white.
Right. So cool. So we'll get back to that. That'll be a new segment that we'll do every now and again. Exercise court, unless we think of a better name.
I like
That
it.
was clamshells, and we'll keep working through those. So
If you want more information or if you want access to the study, please email us. We'll glad to be
send that over.
Yeah.
Yeah.
For
Send it over.
$10 a month.
Talk about it. Please subscribe.
Shit ain't free out here.
No. Got loans to repay. So we're gonna finish up today with a little segment. PT Ad Libs, Mad Libs. What are they called?
I think they're ad libs, but
Ad-
when you make them mad, they become Mad Libs. But I
Okay.
always mess that up. So
Okay.
I
So
don't know.
PT Mad Libs, we'll call it.
yeah,
We're gonna try this out. So
this is more for us than for anyone. I think. I mean, it's finals week. We need a little break here. So
comic relief.
hopefully this is funny.
Yeah.
I mean, I think it could be depending on what happens here. So, what do you guys think about this? Should we go with that one?
Sure.
All right. So the title is "How to Enlarge Your Penis."
Pelvic floor specialists,
yeah.
right
Yeah.
Yeah, we basically are now.
We
So.
should go with that theme.
Yeah.
Should
Go.
for the elective? All right, we need a verb. So we're gonna try to make them all obviously PT related.
Somewhat
So
related.
Perturbate.
like perturbate.
Love it.
complicated.
All right.
Here is
drum roll, please.
how to enlarge your penis, PT style. Play it. Okay. So it's in steps, so I'll read it out. I'll just read it. Step 1. Since you want to be able to chart your progress and show off the first step to perturbate your triggered penis is to get a hooker from the bulbospongiosum district for $69 so that she makes you hard. Then take a picture of your treatment table. Go into your kitchen and grab a goni. Now use it to laterally palpate your penis. This should make you feel hard-tired. I don't know how to make sense. Step 3. Did I say step 2? Oh yeah, I was grabbing your gun. Step 3. Go to your local store and purchase a cuff-weight scented gross lotion.
Scented.
The lotion should be sticky.
Of course.
Massage out a blob on your hand and begin assessing your penis with it. In the middle of the store. But make sure 68 people are watching. Don't worry, this will help your penis become tight. Step perineal body. Oh, I don't think we know that. By this point, your penis should be granulated and pliable.
Gonna need some tens on that bad boy. That granulated.
Wound care.
Some wound
You
care.
can see improvement if you contract it to your fibrous before picture. Step 4. After waiting 1 day, your penis will finally be ready for the final step. Take a red-hot ischial tuberosity and thrust it on your traction room. Now your penis is superiorly large. Women will be strangely revolted and want to tuck you. Congratulations, that was perfect.
That is how to enlarge your penis,
Yeah,
PT style.
I hope you guys learned something today.
Mom, don't listen to anything we just said.
I guess unless there's anything else, that wraps up
Yeah.
episode, what is
I think
this,
that's a
5? Episode 5?
5, yeah.
Yeah. All right. So good luck with your finals if you have finals coming up. Otherwise, we will see you for episode 6. See you later.
Bye.